I am appointed as a senior medical officer, but also assigned duties of district health officer. I have been with Kibuku district for the last 3 years, but prior to that I worked with another district of government in Manafa district. We still struggle with a lot of communicable diseases, a lot of diarrheal diseases, malaria, intestinal worms, pneumonia, and really a few cases of malnutrition in children. We still have a very big population in the district that is not so well educated. Illiteracy levels are actually still high. So this even makes intervention of community programs difficult because you have to translate, you have to take more effort to make sure the people you're trying to reach get the information. So there's a very big mix, the socioeconomic status versus disease burden. It's something we struggle with every day. Being nominated, being thought about by the School of Public Health, by Cadre, for me it's a big appreciation. It's a big motivator for me to go back there, think through things and try to do things better. As senior medical officer and acting district health officer, I've had opportunities to be both a health systems manager but also a practicing medical officer. And as the most qualified person, loosely put, in the health system in Kibuku district is, I think it has driven me to work, but to work very closely with the people, with the nurses, the midwives and the clinicians, but also to appreciate the environment in which they work and try to use my management responsibilities more precisely to improving the health system. As I do my clinical work, as I see patients, I see the real challenges that these people have, I see the gaps in service delivery, and then I use that opportunity as now district health officer to allocate resources, to make decisions, and to move things around.
We worked with Dr. Bumba as a leader of the implementation work that was happening in one of the districts, that is Kibuku district, where we were implementing the manifest intervention. So this was an intervention that was implemented using a participatory approach. So the districts were the ones who were leading this intervention. Dr. Bumba came in, he was able to provide appropriate guidance and leadership, and he is a very dynamic kind of leader, so he was able to stimulates his group, the team with which he was working, to do the work and to take up the different roles that they needed to take up as a team. And then he is also a quick thinker and somebody who is able to think out of the box and who is able to think about how to solve local problems or local solutions or constraints that they are facing.
I also think I have been able to learn from the Manifest project, the things we're doing about rewards and recognition. Because I've been able to say we need to do recognition of health workers. And I've said, okay, we need to start somewhere.
When it came to strategies that the project was implementing, for example, recognition of health workers, when we had a meeting as a research team and where we were encouraging the districts to come up with some ways of maintaining or sustaining that recognition of health workers, he was one of the district health officers who was very quick to think of how he could use the resources available in his other budget lines to buy some presents that he could be able to use to motivate his health workers.
He made sure that much as Manifest he introduced the motivation and recognition of health workers, we have also included in our work plan that activity whereby we shall be annually recognizing the best performers in the different categories, the nurses, the midwives, the clinicians, and next we are going to include what? The environmental health workers.
I made sure we had an opportunity to reward, we got the gifts, rewarded people, everybody was excited. People are looking for the next reward ceremony. People have assured me they won't be beaten the next time. So we started doing something, we learned from it, we are improving, and we'll do better in the forthcoming rewards. Data and use of data as evidence and using it for decision making. Was also something that I want to say we heavily learned working with the Manifest program and the School of Public Health. The districts have a wealth of data, lots of information collected on a daily basis. But before, this data was collected, submitted the ministry, submitted the partners, but as districts we never use this data at all for planning and decision making. But right now, as a district, we implement a quarterly review meeting and we look at data. And in those review meetings, we use the data to make decisions.
He has been able to deploy health workers according to how busy the facilities are. If a facility receives more clients, it's the same number. He deploys health workers according to client-patient ratio.
For a long time, in the district, decisions are made by the political leaders. But we are now trying to change that so that evidence and data becomes the first step in decision making.
I think he's a young man who is ready, who is full of energy and ready to work in a rural district. He's all the time on the ground. If there is a problem identified in a lower facility, Dr. Bumba will quickly rush there, go and find out the problem, and send down a team to go and solve or listen to the affected parties.
The rural setting provides challenges but also provides opportunities to learn. As a young medical officer, right from internship, I believed you needed to be in a place where you had to be at your best. You had to work as much as you could, use the little skills, work and improve upon yourself, because there were no options. In my opinion, the greatest thing that we have got from the partnership is learning that we have structures, we have resources, we have opportunities within the district, and when we put them to appropriate use, we can improve health systems. We can improve health service delivery. Because we have village health teams. We have always had village savings groups. We have always had transporters. But as a district, we never thought of how we can make those connections, how we can get that interrelationship between those different players and get it to improve health service delivery. But that realization that there is a lot more to be done, and building my capacity individually, but also building the capacity of the people I work with me to know that they can actually deliver better services, that has been great.